Hello, my name is Princess Sanders, and I am a student at Indiana State's LPN to BSN RN program. Today we're going to talk about cervical screenings, the facts about them, and why it's important. Before we get started, please take a moment to take the pretest to test your knowledge. I would like to take the time to advise that cervical screenings are intended for all individuals who are born women and have a cervix. Again, all individuals who are born as women and have a cervix. The learning objectives for this presentation are the following. The viewer will recognize the importance of cervical screenings. The viewer will be able to identify the age to start and discontinue screenings. The viewer will be able to list the age groups and recommended screenings associated with cervical screenings. And the viewer will describe facts surrounding cervical screenings. So, what's the importance of cervical screenings? Early detection of abnormalities, early detection of cancer. It encourages the patient to assume responsibility for their own health. Screenings are also considered a secondary intervention for early diagnosis of cancer, and most importantly, it is recommended by the CDC and the American Cancer Society. Here is some important information. You should start cervical screenings at the age of 21. It does not matter if you are sexually active or you are not sexually active. You should stop cervical screening older than the age of 65. There are some important information associated with that, so stay tuned. Here are some age group specifications. Between the ages of 21 to 29, women should obtain a cervical screening every 3 years. Between the ages of 30 to 65, women should obtain a pap smear every 3 years. An HPV test or primary test should be offered every 5 years. And a pap smear and HPV test, which is called co-testing, should also be offered every 5 years. Remember that I told you that there was some information that went along with stopping cervical screenings over the age of 65? Here it is. If you have had an hysterectomy with the removal of a cervix, you should indeed stop obtaining cervical screenings. Also, if you have had greater than 2 previous consecutive normal results, you should also stop cervical screenings over the age of 65. Here are some good old facts. Cervical cancer is one of the most common cancers amongst women. Screenings are instrumental in early detection. Many American women do not get screenings despite the benefits. Cervical cancer is more prevalent amongst women who do not get cervical screenings. Uninsured and immigrant women often do not get screenings. The American Cancer Society, or ACS, continuously offers up-to-date information presented by evidence-based research. ACS is a lifelong resource that provides notifications of changes and recommendations. Also, did you know that an annual well woman visit does not constitute the need for a screening? Not at all. That is actually an opportunity for you and your gynecologist to discuss what's going on with your body. It does not necessarily mean that you need to get a cervical screening. Here is something for my nurses. So, while conducting a comprehensive, holistic assessment for your patient, there are some things that you need to determine and some plan of cares that needs to be in place. For instance, first you want to confirm the gender of your patient. The patient must be a female patient. The patient must also be between the ages of 21 and 65 in order to determine if a cervical screening is needed. You need to know when the initial screening took place, if it took place, and when was the most recent screening. Those dates are very important to know because that will determine whether the patient is due for a cervical screening. You should also determine the results of the patient's prior screening. You should refer back to slide 5 to determine those recommendations as well as the recommended time periods when screenings should take place. If a patient has never been screened and is over the age of 21, has had previous abnormal results, or is due for a screening, please encourage that patient to get a screening as soon as possible. The plan of care that the nurse is able to offer in the community is going through this holistic assessment and determining if a patient should see a gynecologist or physician to obtain a cervical screening. It is extremely important that as nurses, we gather this information in order to direct the patient down the proper channels. We want to make sure that, again, we ask the proper questions to get the patient on their way to a healthy way of living. And this concludes this presentation about cervical screening. I really hope you learned something new, and please don't forget to take that post test to see just how much you've learned. Here are the references for the information presented today. Thank you so much for spending your time with me, and I hope you have a wonderful day.